What do these care centers look like? And are there any challenges you've had to overcome to tackle isolation?
Yeah, it's important to understand that care centers is not the only place that we're in. But if we're just talking about care centers can look very different, right? So you have ALS, which are assisted living facilities. You have long-term care centers. You have nursing rehabs or skilled nursing rehabs. And then you also have even private homes, right? And daycare. So there's just so many different ways that you can describe what we would call a care center, right? And so some of those care centers are more isolated than they've ever been before. So before, there was always, a certain amount of people that can go in and visit people. You can't just walk into any care center. But now, because 40% of the deaths of the pandemic of COVID-19 in Broward County are linked to long-term care centers, now they're just being extremely isolated. So some ALFs that we've heard aren't even letting their residents out of their own personal room. Some are only allowing them to gather and safe social distancing in the hallway. I've even heard some kind of comical stories of our residents taking matters into their own hands and sneaking out of their rooms, and then they'll get caught and then they'll kind of get put back, but they're really isolated. So it kind of varies from center to center, but for the most part, they're experiencing isolation more so than ever before. And you got to understand, before they were already isolated, so now they're even more isolated. But I would say that that's the general frame that they're under.